browning of white adipose tissue, and I've been asked to kind of mention exercise as well in this talk. So the location of brown fat in the mouse, it's mainly interscapular on the back of the mouse. There's white adipocytes in the gonadal and inguinal regions. In infants, there's more brown fat, mostly in the interscapular region. With aging, this brown fat regresses, and then adults are left with very small residues of brown fat in the cervical, supraclavicular, axillary depots, as well as perivertebral and some suprarenal depots as well. And why is brown fat thermogenic? It's because of the uncoupling protein 1. We know that mitochondria create an electrochemical gradient, the electron transport chain, extruding protons from the matrix into the intramembrane space, creating this gradient. When this gradient dissipates with protons going back into the matrix through ATP synthase, this energy is used to capture energy in the form of ATP. Uncoupling protein 1 creates a protein leak where these protons come back into the matrix without capturing any energy as ATP and being dissipated as heat. So it's the uncoupling protein 1 that makes this tissue thermogenic. If we look at brown fat on the far left and white adipocytes in the middle, we see that the brown fat only expresses uncoupling protein 1. The white adipocyte does not. Mitochondrial density is very high in the brown adipocyte, very low in the white adipocyte. The fat droplet is multilobular in brown tissue, where white adipocytes in humans is just one big fat droplet in the middle of the cell. And the primary function for brown adipocytes is thermogenic as well as endocrine, where the white adipocyte is energy storage as well as endocrine. Now the beige or bright adipocyte are kind of induced from white adipocytes to this beiging phenotype. And they do express some uncoupling protein 1, perhaps not as much as in the brown adipocyte. Mitochondrial density also increases, again, not as much as in the brown adipocyte. The fat droplets are multilocular, a little bigger than brown adipocytes. And there's a question of how thermogenic they are in humans and what their endocrine role is in physiology. Now, if you look on the left, these two cells, brown and white adipocytes, derive from different mesenchymal precursors. If they are positive for MIF5, they are really adipomyocytes. They can develop either into brown fat or muscle cells. If they lack MIF5, then they're predestined to develop into white adipocytes, and then white adipocytes can be converted into beige adipocytes. So different lineages for these two cell types. And different, on the right, different transcriptional programs that lead to the differentiation of these cells. White adipocytes really emphasize PPAR gamma, CEBP, SREBP1 as the transcriptional machinery leading to cell development. On the other hand, brown adipocytes really emphasize PDM16 and PGC1 alpha as key transcriptional factors leading to their development. So different cell lineages and different transcriptional mechanisms producing differentiation. The brown fat in health and disease. We know that in humans, cold temperature increases brown fat, aging decreases brown fat. We know that in disease, burns, pheochromocytomas can induce more brown fat formation, and it can be involved in cancer cachexia as well. Here's the cold exposure. On the top, you see mice at 30 degrees versus 4 degrees. The cold temperature increases the mass of brown fat in the interscapular region and causes white fat to beige. Humans is the same, increases brown fat. You see PET CT scans on the far left on the bottom, cold temperature, increasing fat, brown fat in the interscapular subclavicular region and in the paravertebral regions. You see the whole body images in the middle there, and a quantification of fluorodeoxyglucose uptake during PET scanning into brown fat from summer to winter. So it's not only cold temperature, people that live in with extremes of temperature with the seasons can have variable amounts of brown fat during the seasons. But the question is, what's the systemic and physiological import of this brown fat? We know that patients with obesity have less brown fat than patients that are lean. Here expressed, BAT activity expressed per BMI and percent body fat. So the hope here is that we could induce brown fat and increase thermogenesis, bring the patients with obesity, brown fat mass and activity back up to what is observed in lean individuals and cure obesity, right? The problem here is that, yes, cold exposure in humans does increase BAT activity, brown adipose tissue activity. We see on the top graphs that it improves basal whole body glucose at whole glucose disposal with clamps under basal conditions, and also glucose disposal under insulin stimulated conditions. So it increases insulin sensitivity. Across the bottom, it leads to an increase in energy expenditure, glucose oxidation, and fat oxidation. But here's the hooker. We only see these effects in patients with larger amounts of brown fat at baseline. Patients where there's little brown fat detected, we do not see these increases in these metabolic parameters. So it really means in lean patients that do have more residual or observable brown fat at baseline, the cold exposure can increase brown fat and lead to some systemic and metabolic improvements. But patients with obesity that tend to have lower amounts of brown fat at baseline, and it's less inducible with cold exposure, we really don't see much change in improvements in metabolism. What about, can we get white fat to beige and then achieve maybe the same purpose, increase thermogenesis via that route, not brown fat, but the beiging of white adipocytes, and harness that therapeutic potential? We know there's a lot of factors that derive from different organs in the body that can induce beiging. This includes natriuretic peptides, hormones such as norepinephrine and T3, growth factors such as bone morphogenic protein, FGF21, drugs such as beta-3 agonist and PPAR ligands, and myokines, factors from muscle tissue like irisin and meteorin-like protein, which can be released into the bloodstream and act on white cells and induce a beige phenotype. So this looks pretty good, doesn't it? We should be able to harness some of this therapeutic potential to kind of induce beiging of white fat. A lot of this research is done in the mouse, including exercise. Exercise promotes beiging of white adipocytes and increased energy expenditure in mice. Across the top, you see the histological picture of white fat in sedentary animals and a beige phenotype in trained animals. On the bottom, you see induction in white fat of this PRDM16, this key transcription factor for browning, equal to the levels observed in brown fat. In the middle, you see induction of uncoupling protein 1, about 40% of the level observed in brown fat. And you see mitochondrial activity, oxygen consumption rate increasing in white fat from these trained animals. So in mice, this works great. Exercise causes beiging of white fat, and this does enhance metabolism. And interestingly, if you take fat tissue from a trained mouse and then transplant it into a sedentary mouse, you get increased energy expenditure and improved glucose tolerance. Here we see in the red squares glucose tolerance in mice that have been transplanted with fat from a trained mouse versus fat from a sedentary mouse as controls. So improved glucose tolerance, less area under the glucose tolerance curve. This begins to kind of wane away by 28 days post-transplantation. So this kind of led to this hypothesis that exercise could be conditioning muscle to secrete factors, to secrete myokines, which act on adipocytes, convert them to a beige phenotype. They increase thermogenesis and also secrete adipokines that act on other tissues, leading to improved metabolism systemically. And in fact, irisin was created a lot of interest several years ago as one of these myokines. It's kind of a factor that's contained within this fibronectin-like gene, FNDC5. The highlighted underlying amino acids there constitute irisin, perfectly homologous in mice and men. And circulating levels of irisin are increased following exercise in both mice and humans, as shown by the graphs on the bottom. So this looks good. We're seeing release of this factor in with exercise in mice that causes beiging, and that same factor is induced in humans. The problem is it doesn't seem to have this beiging effect in humans. This was an experiment that was both exercise and diet intervention. You can see on the top a decrease in fat mass and total body mass. But on the bottom right, you see there's no induction of uncoupling protein 1 in white fat, even though irisin levels were elevated. And on the left, you see the weight loss is not correlated with uncoupling protein 1 levels or FGF21 levels. So it just doesn't seem to have this effect in humans. So in mice, exercise leads to release of these myokines such as irisin and meteorin-like protein and natriuretic factors, which induce this transcriptional machinery, causing beiging of adipocytes, leading to increase in insulin sensitivity, a lean phenotype, and insulin and a glucose-tolerant phenotype. In humans, some of these same factors are released, but they don't seem to cause beiging. There is an increase in mitochondrial content in white fat, but it doesn't seem to increase energy expenditure. So it doesn't seem like these factors are really getting the job done in humans. What about another approach, a beta-3 adrenoreceptor agonist? Well, there's a history to this. Adipocytes do have beta-3 adrenergic receptors, but these were tested a while back, 1995 to 2003. They were developed for weight loss, but generally they didn't lead to much weight loss in humans. And so that approach was kind of abandoned. But then in 2002, beta-3 receptors were identified in the urinary bladder. And then this beta-3 agonist, mirabegron, was developed, a beta-3 agonist, and used at a dose of 50 milligrams a day for overactive bladder. So people began studying, well, is this affecting metabolism? Can we cause beiging at higher doses than the 50 milligrams? And we can. Here's this beta-3 agonist, mirabegron, in lean men. We're seeing PET scan evidence here of induction of brown fat mass in multiple depots, and quantified as bad activity on the far right, increasing as a result of administration of this drug, 200 milligrams a day now for only 2 weeks, increased resting metabolic rate by 203 kilocalories a day. And you can see the graphs, you're seeing an increase in resting metabolic rate. Unfortunately, this drug also at these high doses causes an increase in heart rate and blood pressure. But here again, we've got a hooker. These were lean men who had cold-inducible BAT at baseline. First, they saw whether they could induce BAT by cold exposure. Those that didn't have inducible fat were excluded from the study. So it's only, lean people with cold-inducible BAT where you see an increase in brown fat with this beta-3 agonist. Obese individuals that don't have detectable brown fat that is not inducible by cold exposure, you would not see the effect of this drug there. It does, in these lean individuals, it does increase uncoupling protein 1. As I said, and hormone-sensitive lipase as well, and so it is causing some browning in these lean individuals. So I think we've got a long way to go before we harness this phenomena therapeutically. Certainly, if we could do this with some of these other factors, and FGF21 is being actively investigated, we could increase insulin sensitivity, increase lipid oxidation and energy expenditure, and this would have anti-obesity and anti-diabetic properties. But think about it, if you heat people up, this can be harmful also, causing organ damage, muscle wasting, immunosuppression, cachexia. We know that induction of brown fat can have poor clinical outcomes in cancer and burns. So I think we've got a ways to go here, but this physiology is very interesting, and I think over time we may see some interventions that do harness this therapeutic potential. So thank you very much.